Hello, my name is Jolene Beerley. I am a forensic toxicologist employed by NMS Labs. I will be presenting on gabapentin in driving under the influence of drug investigations. I am a paid employee of NMS Labs. This presentation will provide an introduction to gabapentin, review its prevalence in DUID casework, and provide examples of DUID cases involving gabapentin. Gabapentin is available under multiple brand names, including Neurontin, and is FDA approved to treat epilepsy, neuralgia, and restless leg syndrome. However, it is prescribed for a variety of off-label uses as well, including insomnia, anxiety, and migraines. In fact, one study found that over 99% of gabapentin prescriptions written in the United States between 2011 and 2016 were for off-label uses. This study also found that central nervous system depressants such as opioids and benzodiazepines were co-prescribed with gabapentin over 50% of the time. The exact mechanism of action is unknown, but current research suggests it does not influence synthesis or uptake of the neurotransmitter GABA as originally believed. Gabapentin binds to N-type calcium channels in the brain and spinal cord, specifically the alpha-2 delta-1 receptors in the NMDA-type glutamate receptor complexes. As can be seen in the diagram on the right, this binding inhibits the release of glutamate, reducing nerve transmission associated with neuropathic pain. Increased total blood serotonin has also been observed with regular gabapentin use. Gabapentin produces calming and seizure reduction not only in humans but animals as well. It is commonly prescribed to dogs or cats for the same conditions. However, humans and animals alike should be monitored for possible reported side effects that include blurred vision, drowsiness, and loss of coordination. Patients starting gabapentin should be cautioned not to drive if these side effects present, since they may cause driving behavior such as weaving, crossing the center line, and ignoring traffic signals. Between 2008 and 2020, gabapentin testing was performed via a targeted quantitative LC-MS analysis with a reporting limit of 1 microgram per milliliter in blood. It is currently included in the Tier 2 DUID testing panel, where it is detected via an initial ELISA screen with a reporting limit of 5 micrograms per milliliter, followed by quantitative confirmation by the same LC-MS analysis previously discussed. Gabapentin prevalence in DUID cases has increased since 2015. The number of laboratories across the United States and Canada testing and commonly detecting gabapentin increased from 5 in 2017 to 21 in 2020. This particular study found the number of gabapentin tests performed increased from 58 to 113 through 2019 by a directed analysis, with a percent positivity above 70% for all years except 2019. The number of tests ordered increased to 163 in 2020 and 124 in 2021 after being included in routine testing. Percent positivities were 8.2% in 2020 and 6.8% in 2021. That is the highest positivity for any prescribed drug in the Tier 2 panel. I do want to note there may have been additional tests ordered for 2021 that were not available for inclusion at the time of data collection. Mean concentrations range from 7.6 to 9.9 micrograms per milliliter over the past 7 years, while median concentrations have remained below 10 micrograms per milliliter. The highest concentration in a DUID case recorded was 63 micrograms per milliliter in 2020. I have included the reported therapeutic plasma concentrations on the right to put these numbers into context. Commonly prescribed doses are 2,400 milligrams or less, but much higher doses have been tolerated short-term. In this group of 50 patients, average plasma concentrations remained below 20 micrograms per milliliter, even at elevated dosing regimens. These concentrations would be the same in blood, since the blood-to-plasma ratio for gabapentin is 1. 254 gabapentin DUID cases were reported between January 1, 2020 and September 1, 2021. 94% of these included gabapentin in combination with other drugs. The top 5 drug combinations include opioids, stimulants, benzodiazepines, cannabinoids, and antidepressants. Fentanyl was included in the opioid class, and 43% of the opioid combinations involved fentanyl. While I don't know if these combinations are prescribed or not, these findings are consistent with the prescription study that found gabapentin co-prescribed with other central nervous system depressants the majority of the time. Given the recent increase in xylazine detections, I investigated how many of these combinations, if any, involved xylazine. Xylazine is also included in the Tier 2 test panel and was detected in approximately 5% of these cases, indicating abuse in a small percentage of these cases. There were 15 gabapentin only cases since 2020. The mean and median concentrations were similar to the totals recorded for the years 2020 and 2021. The maximum concentration reported in this population was 28 micrograms per milliliter and is higher than those typically reported at therapeutic doses. However, I caution against interpreting solely based on blood concentrations given the reported range of dosing, differences in drug metabolism, and tolerance. In summary, the number of gabapentin prescriptions is increasing, and it is commonly being prescribed with central nervous system depressants. This is concerning since combining depressants with gabapentin may cause enhanced sedation and respiratory depression. The FDA issued a warning to this effect in December of 2019. Additionally, gabapentin was implicated in about 15% of fatal drug overdoses in Scotland for the year 2018. The majority of these cases involve depressants combined with gabapentin. Gabapentin abuse is also on the rise. It is easy to obtain a prescription, and drug users have found it can enhance the effects of illicit substances such as heroin and cocaine. 7 states have made it a Schedule V drug, and 12 others include it in their prescription drug monitoring programs in an attempt to control its abuse. Cases of healthcare workers abusing the drug have also been reported. A nurse in Middletown, Ohio was found sleeping on the job. She appeared disoriented and had trouble standing when her coworkers woke her up. She is accused with stealing a resident's gabapentin medication and taking it herself. I will now present 3 DUID case studies involving gabapentin. The first case study involves an 83-year-old man in a single-car automobile accident. Troopers observed him driving all over the road and into oncoming traffic before hitting a ditch. The driver complained of dizziness and was unable to stand at the scene. Blood was submitted for toxicology testing, where the Tier 1 and Tier 2 test panels were performed. A gabapentin result of 17 plus or minus 4 micrograms per milliliter was the only finding. I do not have medical or prescription history for the driver, but these observations are consistent with those reported in other gabapentin DUID cases. The next case study involves a 28-year-old male in a single-car automobile accident. The driver crossed the center line and drove over the center median before coming to rest in a parking lot on a straight stretch of road. Central nervous system depressant effects such as slow movements, poor concentration, and coordination were observed. The driver complained of pain and suffered from amnesia at the scene. He did not remember the accident. The driver was prescribed gabapentin but also suffered severe injuries from a previous automobile accident. Blood was submitted for toxicology testing, with Tier 1 and 2 testing being performed. A gabapentin result of 28 plus or minus 6 micrograms per milliliter was the only finding. While this is the highest blood gabapentin concentration recorded in a single drug DUID case in this study, the interpretation is complicated by previous and possible current injuries. The final case study involves a 68-year-old male stopped for traffic violations. The arresting officer indicated the driver was on the nod with thick slurred speech, but no breath alcohol was detected. The drug recognition expert exam revealed some findings consistent with a central nervous system depressant, including lack of smooth pursuit, horizontal gaze nystagmus, and slow pupillary reaction to light. Lack of convergence was also recorded, but the DRE noted the driver's eyes rolled back into his head because he was on the nod, so this finding may be questionable. Additional observations included slurred speech and poor coordination. The psychophysical tests were not performed for the safety of the driver because his balance and coordination were so poor. Other DRE exam findings were within normal ranges. The driver relayed he was prescribed 1,200 milligrams of gabapentin per day. Blood was submitted for toxicology testing with Tier 1 and Tier 2 test panels being performed. A gabapentin result of 5.9 plus or minus 1.2 micrograms per milliliter was the only finding. These observations would also be consistent with gabapentin use. I would like to thank Ayako-chan Hosokawa for her assistance in this presentation. Thank you for your attention. I would be happy to answer any questions you may have. My contact information is listed at the bottom. Thank you.